Hi everyone, welcome back to Gen Z Science, and today we're going to do episode 2 of How the World Heals. In this series, we travel across different continents to learn how countries and communities respond to different healthcare conditions. And in our first episode, we explored diabetes and how it's managed across North America. And today we're exploring South America to learn about venomous snake bites and antivenom. South America is home to many different environments, including rainforests, wetlands, mountains, and farming regions. These areas are also home to several species of venomous snakes. Snake bites don't usually happen when just like out of nowhere. They usually happen when people accidentally step near a snake or disturb one while working outdoors, or it's very common or more at risk for farmers, forest workers, and people living in rural areas. Snake venom can affect the body in many different ways. It can cause severe swelling, bleeding, tissue damage, muscle weakness, and trouble breathing. The main treatment for serious venomous snake bites are antivenom, and antivenom contains antibodies that recognize and neutralize venom. However, different snakes produce different types of venom, so doctors must use an antivenom that works against the correct snake or a group of snakes. So, first, we're going to explore the different regions throughout South America, some different regions to see how they approach this issue. So first, we're gonna go to Colombia, and Colombia has tropical forests, mountains, and many rural communities where when someone is bitten by a snake, reaching a hospital can be quickly can be quite difficult because of the distance and how it's in many rural communities. Some patients may need to travel far long distances by road or by boat before receiving treatment, because antivenom works best when it's given early, and transportation can be an important part of saving the patient. Doctors may look for symptoms such as swelling, bleeding, pain, weakness, or changes in breathing. They may also ask where the bite happened and what the snake looked like. However, people should never risk another bite by trying to catch the snake. Next, Brazil. Brazil has a long history of researching snake venom and producing antivenom. To create antivenom, scientists carefully collect venom from snakes, small controlled amounts, and are then used to help an animal, often a horse, develop antibodies against that venom. These antibodies are collected, purified, tested, and prepared as antivenoms for hospitals. Scientists in Brazil also study how venom affects the body. This research can help improve antivenom and teach doctors how to treat different types of snake bites. Interestingly, substances found in venom have also helped researchers study areas such as blood pressure, blood clotting, and pain. Our next stop is Paraguay. Many people in Paraguay live or work in rural areas where hospitals may be far away. Because of this, knowing the correct first aid response is extremely important. After a snake bite, people should not cut the wound, suck out the venom, apply ice, or use a tight tourniquet. These actions can cause additional damage and do not remove the venom. Instead, the patient should remain calm and avoid moving the injured limb unnecessarily. Remove tight jewelry before swelling begins and seek health care. Um, immediate care. Public education can also help avoid harmful home treatments or reach a hospital more quickly. Our final spot is Argentina. Argentina has different climates and environments, meaning different snake species may be found in different regions. Doctors need to understand which snake live locally so that they can choose the correct treatment. When a patient arrives at a hospital, healthcare workers may check the person's breathing, blood pressure, swelling, blood clotting, and kidney function. Antivenom is usually given through a vein. Doctors may continue monitoring the patient because some people may experience an allergic reaction to that treatment. Patients may also need fluids, pain medicine, wound care, or help breathing. This shows that antivenom is important, but additional medical care may also be necessary. Now, we have traveled across South America. We saw that snake bite treatment involves more than simply having antivenom, and Colombia showed us how distance transportation can delay treatment. Brazil demonstrated the importance of antivenom production and research. Paraguay highlighted the importance of public education, while Argentina shows the need for careful hospital treatment and monitoring. Together, these countries show that treating snake bites requires scientific research, trained healthcare workers, transportation, public education, and access to correct antivenom. Thank you for watching episode 2 of How the World Heals, and stay tuned as we continue to travel across the world and learning how different communities use science and medicine to help people heal other conditions. Thank you.